Hormones can have an effect on melanin production. Estrogens, for example, interfere with melanogenesis by causing an increase in melanin production. Estrogen levels increase during pregnancy and often in women taking contraceptive pills. Progesterone also fluctuates during pregnancy and in some birth control pills. With the fluctuations of estrogen and progesterone in conjunction with UV exposure, this can lead to hyperpigmentation. Some diseases in UV exposure can stimulate melanocyte-stimulating hormone from the pituitary glands or from inside the keratinocytes. Melanocyte-stimulating hormone directly targets the melanocytes by binding to the melanocortin 1 receptor on the melanocyte surface. Let's take a look at melasma. Melasma is the term given to women with hyperpigmentation that displays as a butterfly pattern across the face, so predominantly on the cheeks, the forehead, and the chin. Melasma may often be referred to as the mask of pregnancy. A hormonal imbalance is the cause of this type of hyperpigmentation. In the case of pregnancy, estrogen is the culprit. The increase in hormonal activity spurs an increase in melanin production, which can then be exacerbated by UV exposure. Melasma can sometimes resolve itself after the hormone levels become balanced again, but this is unlikely if the discoloration has been exposed to UV rays. Melasma can occur in the epidermis, the dermis, or what we refer to as mixed melasma, which means the dermis and the epidermis. Dermal pigmentation is always more difficult to treat and cannot be treated successfully with topical skin lighteners. We mentioned post-inflammatory hyperpigmentation earlier. So what is it? Post-inflammatory hyperpigmentation is due to an increase in melanin production triggered by an inflammatory component. Post-inflammatory hyperpigmentation can arise from an injury or a blemish, something that's caused the skin to become inflamed, followed by an increase in melanin production, which is often exacerbated by UV rays. In the case of UV exposure, the skin may appear to have normalized. There might be an underlying inflammatory chronic response occurring even if there is no erythema present.